Howdy y'all, I'm Dr. Barbie. Today I'm going to talk to you about the 5 golden rules of skeletal muscle activity. Today's presentation is going to go over the 5 golden rules of skeletal muscle activity. You know that skeletal muscles are primarily attached to the bones of your skeleton, and they tend to pull, not push things. So they usually work in pairs. One will pull a bone in one direction, and the other will pull it in the opposite direction. Those two muscles that work together and do opposite actions are often referred to as the antagonists of each other. One of the harder things that students usually have to figure out in this unit of study is determining what is the antagonist muscle, what muscles are doing the opposite action, because that's not something that you can find in a handy chart in your book. Most of the time your skeletal muscles cross one joint. Some exceptions to that are the muscles in your face, which are often attached to fascia or soft tissue. Usually the bulk of the muscle lies proximal to the joint that is crossed. You're going to want to refresh yourself on those directional terms when we're talking about muscles and their location and their actions. Most muscles have at least 2 points of attachment, referred to as the origin. That's the more stationary area, and the insertion. That's the part that actually is moving when the muscle contracts and shortens. The insertion moves towards the origin. This is the diagram in your packet that's just showing. This looks like your brachialis muscle, showing that it's attached to 2 bones, the humerus and the ulna. When it contracts, the ulna is the part that's moving, and the humerus is staying more stationary. So that's why this is referred to as the origin, and this point of attachment is referred to as the insertion. It would take another muscle on the other side of this bone, the triceps brachii, that's probably also attached to the humerus and down to the radius or ulna, and it'll contract to bring that bone back into its original place. So that's what we're talking about when we're talking about antagonists. So you're primarily going to be focusing on the prime mover, the main muscle that moves something in a particular action. A lot of muscles have other little muscles that help them do the same actions, called a synergist. Sometimes you have muscles that help stabilize the origin. Those are called fixators. You may have noticed that if you're doing sit-ups and you tuck your toes underneath the edge of the couch or something, then you can use your legs to help fixate your femur while you're doing your crunches, and help fixate your pelvis while you're doing your crunches and getting your abdominal muscles, giving them a workout. We're going to focus primarily on the prime movers and the antagonists. And so in that event, you might want to learn about some of these muscles in groups instead of as individual muscles. Most of the time, the flexors are located on the anterior side and the extensors are located on the posterior side of a person. However, the exception to that rule is your knee, which when your hamstrings group is flexing your lower leg, actually pulls it back towards the back. So that is the exception to that rule. And then the antagonist to that is your quadriceps group is going to pull that lower leg back forward again into the anatomical position. The adductors are most primarily located in the medial side of an appendage, and the abductors that take it away from the midline are located on the lateral side. So here's your tensor fasciolata muscle that's attached to this really long tendon. A lot of you are familiar with your IT band. That stands for iliotibial tract, because it goes from the iliac crest of your ilium all the way across 2 joints to your lateral side of your tibia. Most of the time, the bulk or the body of the muscle is located proximal to the part that it's moving. So these muscles found in your upper arm are primarily moving your lower arm. The muscles that you find the flesh of them primarily in your lower arm are mostly moving your hand and changing things at your wrist, flexing or extending at your wrist. The exception to that rule is this muscle right here, the brachioradialis. It's actually crossing the elbow joint, and when you flex it, when you contract it, it will flex a pronated forearm. So that muscle is really good for winning at arm wrestling contests, because you can contract it when your arm is in a flexed position. when your biceps is flexed. It's sometimes misleading who will win arm wrestling competitions, because this muscle is like the Popeye muscle of your lower arm that helps you win that competition. Most people look at shoulder and biceps brachii when they're like, ooh, who's the strongest? Who's going to win that competition? I hope this helped. Bye.